everyone. Welcome to Inside Iraq. I'm Jassim Azzawi. A cholera outbreak in Iraq is threatening to overwhelm the country's healthcare system and has revealed that millions of Iraqis are without safe drinking water. Is Iraq on the brink of a nationwide cholera epidemic? Violence and sectarian killings have forced thousands of Iraqi doctors and medical professionals to flee the country, leaving hospitals without adequate staff. So how will this brain drain be reversed? The international community has provided Iraq with medical supplies, but most of it ends up on the black market. Without firing corrupt government officials, can an epidemic be averted? Rawia Ragah reports.
A cooling dip in the Euphrates. Iraqi boys trying to escape the harsh realities of life. But now, even here, there are hidden dangers. A widespread outbreak of cholera in 9 of Iraq's 18 provinces has left 3,300 people infected and 15 dead.
This is caused by many things, like the severe lack in services. The government isn't doing enough. The water we get is untreated. Let them come see how we are living amid disease. Where can I start?
Cholera is relatively easy to control. Its re-emergence in Iraq highlights how the health system has disintegrated like the rest of the country's infrastructure.
We've contacted all the officials and regional organizations, and they've all expressed support. Here at the hospital, the medical staff are doing their best. We don't want people to panic, but we're trying to spread awareness as much as we can.
The violence in Iraq has led to a brain drain that's left the country with only a third of the physicians it needs. That's according to the military surgeon general. Hospitals have come under repeated attacks, and reconstruction projects have been derailed because of corruption of both Iraqi officials and foreign contractors. Only 6 of 150 health facilities were completed by one U.S. contractor, according to a 2006 report by a U.S. auditor. Power cuts and lack of chlorine have helped cholera take a hold. This in a country that once boasted the finest healthcare system in the Arab world. It didn't take much for this woman in Al-Anbar province to faint and be rushed to the hospital. She just had a sip of tap water, her mother says. And as with everything in Iraq, the country's neighbors are worried of a spillover.
Already, Iran has reported 43 cases of cholera near the Iraqi border, and Jordan has stepped up efforts to prevent the disease from spreading into its territory. As for the Iraqi people, they can only hope that the disease can be contained before it claims more lives. Rawia Ragah for Inside Iraq.
To appreciate the extent of the cholera outbreak and the risk facing Iraqis, I'm joined from Erbil in northern Iraq by Iraqi Minister of Health for Kurdistan Regional Government, Dr. Zarian Uthman, and by Dr. Naeem Al-Qasir, World Health Organization representative in Iraq, and from Amman, Jordan, by Hisham Hassan, spokesperson of the International Committee of the Red Cross. Welcome to Inside Iraq. Dr. Uthman, what is the extent of this outbreak? Are we looking at an epidemic, or this is a manageable outbreak?
Well, cholera is endemic in many of the Middle East countries, including our country. We had the last outbreak in 1999 when we had several thousand of cases of cholera reported. This time we noticed an increased case of diarrhea since early July. Then in the middle of August we discovered the first cases of cholera. I can describe it with it's a moderate outbreak. It's a contained outbreak with the guidelines and implementation of the steps we have taken with the aid of the WHO and the other international organizations like the UNICEF, the help of the ICRC, WHO, and many others. I would say the disease is very much on the way of control now, and the number of cases on decline at the moment.
Yet, Dr. Naeema, fear is driving this, the way the Iraqi government perhaps is handling it. Although, you know, WHO has catalogued about 3,300 cases, only 14 deaths, although the deaths, they start all the way from Erbil and Hawk to Al-Basra, which is covering the entire country. Yet, to what extent this could get out of hand?
Okay, just I want at the outset to indicate that the World Health Organization as Dr. Chan is very pleased and Dr. Jazari very pleased of the transparency of the government of Iraq in announcing. His Excellency Dr. Zerian was the first to announce with the support of the Minister of Health of Iraq. The concerns are there. The number of deaths, the fatality rate is considered very low, and which is an indication of the, as His Excellency mentioned, the rapid response and the treatment of the cases. The one case in Basra, the one case in Duhok, these are individual cases. There has been control measures immediately, rapidly. It is an outbreak in Suleimania and Kirkuk, but not a spread to the other governorates as an outbreak. We are having few cases here and there. The concern of the government of Iraq is to ensure the safety of water to the public, especially in the hotspot areas. We welcome such concern because it requires concerted efforts and actions, not only from Ministry of Health. This is not a Ministry of Health issue. It's water, it's the sanitation, it's the hygiene practices of the people. They are the key. People also are very important element in ensuring that the spread is controlled. We are calling on this message the media and the journalists to be partners and the pillars in distributing the healthy messages to the people on how can we control the spread, because cholera is easily treatable and easily preventable.
Since you mentioned water, and water is very key in this case, in 2003, 50% of the Iraqis, they had access to safe water, Hisham Hassan. Right now, 70% of the Iraqis, they don't have access to potable, clean, safe water. Aside from educating people, aside from telling them, you know, don't drink polluted water, what else can they do? Right now, it seems that the solution is in something called oral rehydration salts. It's a little sachet. The World Health Organization, as well as other people, are providing the Iraq. Each sachet is costing just a few cents. Can you comment on that, Hisham Hassan?
Well, I couldn't but agree more with Dr. Naeem and what was said before about the efforts being undertaken in Iraq to solve this problem, or at least limit it for the time being. However, in the same time, we know that the solution for this does not simply come, as been said before, by medication or other kinds of campaigns, of course, and I'm sure your other guests would agree. The fact remains that there are problems today, not more in the north of Iraq, but probably in the other areas in Iraq, in the problems of infrastructures, meaning we're talking about the sewage system, for example, and the fact that the lack of maintenance taking place today in the sewage system is affecting the potable water today in Iraq. Now, another very important factor is security constraints. People are not able to move. They're not able to go fetch clean water, potable water, so they have to use the water they have, which is river water or well water, without knowing that it does not suit them. They could not drink that water. So I would say that more efforts should be undertaken either by the authorities generally in Iraq, but also by other actors, international actors that are working currently there.
Dr. Uthman, chlorine comes as a very strong remedy, plays a big important role in water purification. Does Iraq have enough sufficient chlorine in order to use it in the water purification system? I understand in the north you need a lot more of that chlorine now.
Yes, I think chlorine has been a little scarce after it has been used in some chemical gas weapons, but we do have enough chlorine to chlorinate waters, really. It's a job for Ministry of Municipality. We have never run out chlorine completely. I don't think it's a matter of lack of chlorine, but it's a matter of technicality, whether adequate chlorination has been made or not. And it's not the actual chlorination of the water source, really. It's also the water networking of the city. Most of the networking is very old, and so over 50 years old, and usually leaking and broken, and it sucks sewage from the neighboring pipes, and then the water is contaminated at the terminal to the people's houses. with the shortage of not just the quality, the quantity of water supply as well is short. And a city like Suleymaniye now, for example, only gets something like 30% of its requirement of water, and people are obliged to dig shallow wells in their houses, and these shallow wells are usually well contaminated with sewage water. We have proof on that. We have over 50% of the water samples from those wells contaminated with fecal flora, and this is the origin of the problem, and this has started the outbreak.
Dr. Uthman Zerian will take a short break before we continue our discussion with the three experts. Stay with us.
18,000 physicians left the country since 2003. 250 of those that remained were kidnapped, and in 2005 alone, 65 Iraqi doctors were killed. MEDACT, Medical Campaign Group.